Live. So I haven't been live on YouTube in a long time, but hey, we're gonna go ahead and do it. Nothing else to do, nothing else left to do but do it. So what questions do y'all have? When it comes to radiology technology, most people do not know what it is that we do. So this chat is going to, while I'm making my lunch, this chat is gonna explain to you all what we do in the field of radiology, because I think that's so important. Many of you have actually gotten radiology exams and don't know that you've gotten them before. Such things as CTs, MRIs, X-rays, nuclear medicine exams. What else is radiation therapy and ultrasound or sonography, as some people call it. Then you have bone density scans, mammograms, all of those things fall under radiology. Most people just think we take x-rays of bones, but we actually do imaging of every part of the body, outside and inside. We can look and see if we can watch your baby. I do MRIs and we actually watch the baby move around inside the mother. And the reason we do MRIs of pregnant women is because it is relatively safe, following precautions, of course. But also we want to see how viable the pregnancy is, what kind of deformities usually the baby may have. Women are pregnant maybe with conjoined twins, and we're able to use MRI imaging so the doctors can prepare for when they do have to deliver the babies, who needs to be there in the operating room for the conjoined twins, or how they're going to surgically prepare. That's how detailed MRIs are. Very detailed, where they can plan their surgeries based off of fetal MRIs. We do cardiac MRIs. Who would have known that we could do cardiac MRIs? But yes, we do vascular. We watch the heart. And when I worked at Children's, I did more cardiac studies there. It wasn't my favorite. It was a very intense, because you're working under the guidance of cardiologists and pulmonologists and a radiologist. So you got 3 doctors surrounding you. The patients are pediatrics, usually teenagers who have had heart surgery, and they've got to be right there, on the table. Those exams would start they would take so long. I'm trying to make sure I can see, I'm trying to show the chat, but it doesn't seem like it wants to. Hello. So for cardiac studies, the patient is on the table. We have to inject contrast in the patient when they're getting cardiac MRI studies done. And again, this was pediatrics, but adults, we did the same thing. But with children cardiac studies, what people don't know is a lot of times their hearts they've been operated on, maybe at birth, maybe throughout their childhood, because they have a congenital heart defect. So the anatomy that we've studied for cardiac MRIs is not what this patient has. And that's why it takes specialization for individuals to be able to do cardiac MRIs. Everybody who does MRIs does not sit down and do cardiac MRIs, because it's not textbook. Every particular patient is going to be different when it comes to, especially pediatric cardiac. I'm only talking about pediatric cardiac MRIs now. It's going to be different. Where one valve is in the patient, then another valve is somewhere else on the books. So that is definitely why we have to be careful with who does the MRI scans when it comes to cardiac, because this patient we have to determine if this patient is going to need more surgery or did things go well. And usually the patient is coming back in because they're having issues with their heart surgery, and they may need a follow-up surgery. So pediatrics was my favorite to work in. It still is. If I went back into a hospital setting full time, I'm a contract worker. So if I went back into full time, I would definitely go back to pediatrics, because things were so organized. The patients just were so happy. I mean, I just enjoy pediatrics. We have so many options to work in radiology. You don't have to just do patient care. Some of the things that I've done, I've been an educator for 7 years and worked with educating individuals in radiology. Specifically, I was an MRI instructor for 7 years, and that was a lot of fun. I learned a lot. I realized that I didn't really like the education side that much. It took me away from the patients. I enjoy the patients. I did clinical applications for a while, which was really cool. I went in and taught individuals who were getting a new machine, whether it was CT or MRI. Those are the 2 things that I did clinical applications on, which is basically going to a clinical setting, teach the staff how to use the equipment, the MRI scanner, the CT scanner, how to perform exams on it, because maybe they were used to working on a GE. Now they have a Siemens in, so you come in and you teach them how to use that machine, and you put the protocols on there, you put in the protocols, all of that, and you teach them basically how to put in the protocols, how to do those things. So that was a lot of fun. I gained my training through years of experience, and also I went to Siemens headquarters and got training there. So that was a lot of fun and added to my experience. Some of the other things that I did, I worked in brain research, MRI, for a very long time. That was phenomenal. Never thought that I would do it. I had opportunities to work in research before with MRI early in my career, but it never panned out. But things come full circle, and a coworker of mine needed me to fill in for her research job at another facility. And at that facility, I was pretty much just doing IVs. So people would get research studies done on them, and they needed to have IVs placed in them so they could put in whatever it was that the study was about. So I was putting in IVs. And you might say, why not a nurse? As radiology technologists and MRI and CT technologists, we had to learn how to do IVs. So I actually floated through the hospital with the IV team and learned how to place IVs. Thank you so much. This is a Soma Intimates dress. It's got the pockets. Yes, yes, yes. I love it. It's so comfortable. I don't know. You guys love Soma Intimates? I love Soma Intimates. I make a peanut butter and jelly, and I like to toast my bread. I know that's kind of weird for some people, but I like to broil and get a little crisp on it, then put the peanut butter on top of it, and it just goes so smooth. But yeah, Soma Intimates, they have some of the cutest dresses, and it's wintertime here, but I'm in my house, so I'm not cold. But yeah, so MRI, I loved MRI, CT. I did research on that, but I also did IVs, so I was able to have another skill. And that's the one thing in our field, people think we just take x-rays, but we actually are able to inject contrast. I was at dinner with one of my friends that's a nurse, and she was like, y'all inject contrast? Like, yeah, we put IVs in, we inject contrast. We can inject contrast several ways. It depends on what study you're getting done. You either drink the contrast, and we wait for it to fill up the bowel system. We have to wait a certain amount of time, and each patient is going to be different on the transit time. So some people don't drink it, and they have ileostomies. So they'll inject the contrast through the hole in their stomach, which is how they poop. So we got to get it in there, and we immediately have to take pictures because it'll come right back out the bag. So we just let it go in real quick, and or they'll drink it real quick, and it's going to come right out real quick. So you have to know what your patient is dealing with in order to get the right, this bread round really quick. What your patient is dealing with in order to get the right scans done at the right time. So I really enjoy working in radiology because we get to see so many things. You also can inject contrast through the veins. So that's IV contrast. And we'll have sometimes speech pathology, we work with them, and we'll have a patient drink the contrast, and we watch it as it goes down the throat. So if people are aspirating, especially geriatric patients in nursing homes, sometimes they are aspirating. So you have to be able to figure out how to stop them from aspirating, because if fluid gets in the lungs, not a good thing at all. Not a good thing at all. Let me get my peanut butter. I'm coming back. So what we have to do is make sure we work with a speech language pathologist and do an exam with them drinking contrast, while we take live pictures of them drinking the contrast. Doesn't always go as planned, because not all, especially pediatrics, but we have a special way where our pediatric patients love to drink it. You put it in, this is the babies though, not the adults. It's not the adults. But you put it in something really tasty for them. We'll put it in applesauce. For geriatrics and pediatrics, we kind of do the same thing. So I started out in geriatrics, and I just love geriatrics as well too. It's just really special over there. A lot of people, you just assume, oh, I don't want to work in a nursing home. I don't want to work with I'm going to tell you, you get the biggest laughs working with children and older people. Because kids say whatever comes to mind, and adults say, geriatric patients say whatever comes to mind too. So if your feelings get hurt quick, you may not want to work with either one of those populations because they would tell you the truth. And then they're just, sometimes some of them have dementia. Talking about a geriatric patient. Some of them have dementia and some have Alzheimer's. And some just say I'm old. I can say what I want to say. But I really did enjoy working in geriatrics and pediatrics. Those I would say are my two favorites. I volunteered at a nursing home before the pandemic, and I missed volunteering there. I need to go back. After the pandemic ended, my schedule changed, so I didn't have the time anymore. But I'm gonna make time for that because that was a highlight of my week, was when I went there and just walked around and visited. My uncle was in a nursing home, so I would go down to Florida every week and spend Wednesdays with him in a nursing home. So one of my friends' grandma was in a nursing home, so they all worked full time, so they couldn't get in there to visit her. So I was already over there because I worked at a hospital near there. So I went and visited her one day, and we had the best of time. So I would start going over there for lunch with her. I get my lunch out of the refrigerator, and I go sit over there with her for lunch. And then all the other older people were like, "Wait, how do you have a visitor?" So they would come to the table and join us for lunch, or come outside with us and have lunch with us because they were lonely, and it just became a regular thing. But it was so much fun. So if you have never been to a nursing home, go visit somebody and just spend lunch with them, even if you don't know them. It'll make their day. So I got my peanut butter and jelly sandwich. Look at this char, this little browning to it. It's so good. This warm peanut butter. And then siete chips. I try to cut down on the grain. I'm trying to eat right. So I love siete products. If you have not tried them, try them. They are grain-free tortilla chips. These are the sea salt. My husband and I ate a lime up already. So these are the sea salt ones. But yeah, a little bit more about imaging. I wonder if you guys knew any of this stuff about radiology. A lot of people don't really know that we inject contrast. The other final third way that we get contrast into our patients, you may be a little shocked and you may not, is we inject it through the rectum. Yep. So we'll inject contrast through the rectum in patients because sometimes we need to just look at that part, the large bowel system, the bottom part. We don't need to see the small bowel. We just need to see and then some raspberries. Gotta have some fruit. The large bowel system. So that's pretty much how we get our imaging done. And it's really interesting because it's not as bad as people try to make it out to be. I don't think so. It doesn't bother me. I actually enjoy all the different things that we can do in medical imaging. And early in my career, I didn't say no to things because I'm not saying I like doing them all. Raspberries, yep. Staining on my hands, so I gotta clean that off. I didn't say I enjoyed doing all of the exams, but I will say it taught me a lot about how to deal with patients, even when I had exams I really didn't like to do. Even when I had very uncomfortable exams or exams I wasn't very good at, because if you don't do certain things like cardiac, I don't do it often. So I wasn't that great at it. And that's the thing. You got to do certain exams to be good at it. So you can shy away from doing things in our profession when you're not, or any profession, when you're not doing it on a regular basis, so you can get back on it, you're really slow on it. But yeah, so that's another way. And we don't just put contrast in the rectum, we also put ultrasound gel. So prostate exams, we do prostate exams, and some places have a coil that goes into the rectum so you can see the prostate better. A lot of places have done away with that. Don't do that because depending on the prostate size, and you can cause damage if it's not inserted the proper way, which leads to other issues. So what they do now is, it's very widespread. We put ultrasound gel into the rectum, and then we take pictures along with IV contrast for the prostate exams. And this gives really I know you think ultrasound gel with MRIs? Wow. like, how does that work? The hydrogen inside of the hydrogen molecules, water molecules inside of the ultrasound gel really give a good, clear definition of that prostate and everything around it. So they're looking, it really just highlights the prostate even better because you don't have that coil right up against it. The closer the coil is for MRI to the body part, the more detail you have. And there are different things in the prostate that they need to see if there is a tumor or something or some kind of growth inside or infection in the prostate. They need to be able to see it, and it's in the back part of the butt, but it's in there. So you want to be able to, if you can get close to that, you want to be able to get close to it and see. So yeah, that's pretty much how that goes, and that's a little bit about radiology and imaging. Thank you guys for being on this live. I will try to be more regular on the YouTube lives because I'm going to give all my attention to YouTube in 2025. So be sure to subscribe. Be sure to follow me here. Engage in the comments. Let me know what you want me to talk about. And I'm going to make a more consistent schedule of being live and do some premieres so you guys know what the topic's going to be about. And you can ask questions, legitimate questions about the profession of medical imaging and what we're all about and how you can maybe join and inspire other people to look at us as a career path. And if you are going to get any of these exams, you'll be able to now know who we are. We are not nurses. We are not the radiologists. We are radiologic technologists, medical imaging professionals, and radiation therapy professionals. So thank you guys for your subscribing to my channel. And be sure to check out my podcast, which is a couple of Rad Tech's podcast. It is a top 5% podcast speaking all about radiology, career tips, and more. And I know you guys will enjoy it because we made it the top 5% and we're on our way to top 1%. We got more to come to this page. So thanks, y'all. Enjoy your afternoon. Enjoy your lunch. And until next time.